Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. When what you're told goes against everything you've known until now, it may be prudent to start questioning the new information. This isn't to say that new evidence should be discounted. Science is or should be about challenging old dogmas and revising premises based on new and reproducible findings. Still, some things have been proven repeatedly and known for generations. When the COVID countermeasures were rolled out, they contradicted what has been known till then about health and well-being. Sunshine, despite current dogma, and the outdoors have always been considered to promote good health and be restorative to the body. In fact, before antibiotics, hospitals had solariums, imagine that, to keep patients outside so they could heal with the fresh air and sun. Being outdoors is also better than being indoors because people in close quarters are more likely to spread illness to each other. The more cramped, the more contagious. And of course, for many people, especially children, exercise, also important for health, is often done outside and with friends. Yet suddenly, people were being told to stay inside. That was the opposite of everything we knew. As for masks, studies, including ones from before COVID, showed they not only failed to prevent infection, but could also be harmful. Similarly, the 6-foot distancing, closing some businesses but not others, closing houses of worship but not casinos, had no historical precedent or sound basis and was completely arbitrary. Similarly, 15 days to stop the spread. Remember that nonsense? And the 6-foot social distancing rule defied logic. The public was misled to believe that the vaccine would stop infection, but only if everyone was vaccinated, meaning that your vaccine was not enough to protect you. They said the same about masks, that yours wouldn't work unless everyone wore one. Well, that's kind of like saying my ADT home alarm system will only work if all my neighbors have the same system. Absolutely absurd. Another one, you should get the vaccine to protect grandma. Well, that's kind of like saying my ADT system will protect the entire neighborhood. Ludicrous. Keeping people apart also contradicted what we know about human contact and companionship. People need human contact to be healthy and sometimes to even survive. But you were only allowed to be with those with whom you lived or had constant contact, leaving many people, seniors especially, isolated from loved ones. And since when was it a bad idea for a family member to be visited by a loved one in the hospital? That was simply cruel. Promoting a rush vaccine, which was truly novel, unlike coronaviruses, and limiting treatment to things like remdesivir, a drug shown to be more lethal than Ebola. Think about that for a moment. And monoclonal antibodies, all by the way under emergency use authorization, didn't make any sense either. The takeaway is this: centuries of accumulated science and wisdom don't shift for one particular pathogen. It's up to us to discern where the real mis and disinformation is coming from and to act accordingly. Simple tips to remember. If someone's making you afraid, they're simply trying to manipulate and control you. And, contrary to what some people may think, no government in the history of the world has ever made decisions that are in the best interests of its citizens. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.